What would be the role of the league administrator when running a youth sports program to ensure the kids' safety?
Well, I think one of the major roles is making sure that health care provisions are provided for the teams, for the tournaments, and there are various ways to do this, but it's the responsibility of the administrator to put a plan in place that covers providing health and injury care for the participants.
When you look at youth sports now compared to even like 10 years ago, are they safer? Are we going in the right direction? Are we going in the wrong direction?
Well, I don't know. The numbers have like boomed. So you have so many more participants. You have participants starting at a younger age. You have so many more venues where they're playing. So it's always been hard to get your arms around that population. It's even harder now because of the numbers. I'm not sure we have data to show if we're affecting a decrease in injury in this population yet, because again, keeping track of data is very hard. But I know that the urgency to provide proper health and injury care for this population is great from a nationwide variety of professional societies and resources. So the spotlight is on keeping these kids healthy.
If you're a parent and you're enrolling your child in a program, is there any way to evaluate the safety of a program, one over the other, before you decide to put your child in?
Well, you know, that's an easy question. You say, okay, if my son or daughter gets hurt, what provisions are in place? What happens when an athlete or a youngster gets hurt on the playing field? Tell me what's in place. That's the easiest question, because that's what goes through every mom or dad's mind. What happens when my kid's hurt? Unfortunately, they ask that question when the child is injured, not before. Ask it before.
How serious a problem is sudden death injury or sudden deaths in youth sports?
Well, you know, sudden death grabs the spotlight. Fortunately, the occurrence is not a high number, but there are definite things that can be done to prevent exertional heat deaths, recurring concussions, and brain damage. So although many of the sudden death episodes can't be prevented, you need to have a knowledge of what prevention can be applied to those that you can affect.
As a youth sports administrator, are there other issues or situations that really need to be at the forefront of their thinking when they're conducting their program?
Well, you know, I say you shouldn't put a program in place or a team on the field or an activity in place without proper medical care. And that involves a physician consultant. Not necessarily that you have to have a doctor on every sideline, but you can't rely on the parent who may be a doc. You know, that takes them totally out of the professional role. They're there as a parent. A plan in place to access physicians, to have a certified athletic trainer available, to put a plan in place, what happens when injury occurs. And once you have the plan in place, then when an incident happens, it works like clockwork on what everybody's supposed to do. Without that plan, it's chaos.
As a league administrator, when you're running a big tournament with a lot of teams in town, what advice do you have for them to have protection for a lot of kids?
Well, contact your local hospital or large sports medicine practice. It's great public relations, and you get in front of thousands of parents to say, hey, we care about your kids. We're providing the sports medicine coverage for this tournament. It happens throughout the country. If you're in rural areas, you just have to ask more questions and see what hospital policies are or what their interest is, or again, with physician practices. It's being done more now than ever, and it's a great resource for you.
What would be the number one tip you would give for someone maybe taking over a job of a league administrator for the first time running youth sports to make sure they're safe?
Put a plan in place, educate your coaches, and have athlete education. You know, ultimately, at the end of the day, we're all responsible for our own health care. If you can teach kids at that age how to take care of themselves, how to say to the coach, hey, I need to come out now because I got hurt, rather than playing through pain and gutting it out. When they're past this age, those traits are set. You can influence these kids and how they view their own injury and how they take care of their own injury. So let's not forget about them.
That's perfect. That's great. Thank you very much.
Good. Thank you.